Hey everyone, I won't be able to see the chat on this, so you have to forgive me. My cam is dark at the moment, but I'm going to get ready. My chat will be on this computer, but I'll be over doing my therapy. So if anybody comes on, I'll try to check on my phone during. Other than that, I'm going to turn the lights up, which I normally don't have up, and position my cam, and I'll be right back. All right. See if that got any better. Give it a sec, it's got a delay. There it goes. Now, I'm not sure how well this is going to show because I only have so much cord. I'm going to head over there, and I may not be able to see the chat right away. Maybe I'll wait a little bit to see if anybody else comes in. But what you're seeing right now is my inversion table. So I'm going to be doing my inverted chest therapy on it tonight. I don't know if I have the camera there right now or not. That's where I'm setting it for right now. I'm setting everything up. But I'm going to use my inversion table and my cell phone as my stopwatch, as I normally do. I'll usually watch them on TV, but I won't while I'm doing this. Hey, dude, all good. I just told everybody I was going to do this tonight, so a couple people asked, so I'm going to do it. Now, normally I don't have the lights this high. I'm going to try. I'll be moving this around during. There's my little book. I keep track of everything. I do. It's not neat, but it's more than most people do. Now I'm going to try to position this. I have to go back and check back at my computer. Right back. Well, it might be too close. I also point the light a little more. Let's see. Oops, do I have enough cord for this? As long as my cats don't knock this over, that might be a better angle. But I have cats, and they're evil. Hell. Hey, Paul. Or hey, Paul, I don't know if you can hear me. I'm going to aim it just a little different, and I'm going to get going on this. I know Lady Ryan kind of wanted to see it, but said I was going to do this live tonight and get this done. You can see some of my posters, everything better now with my light turned up. Okay, that's about as good as it's going to get. Got the legs pulled out as good as good on this tripod. One last check of my setup and see we go. All right. Like I said, I won't be able to see the chat while I'm doing it because I use this as my timer. But after, when I'm coughing, I can look. And normally I watch TV while I'm doing this, but copyright and noise for this, so I'll do it al fresco. definitely gonna be blood. One more minute. If that seems like a long time to you, it really does to me too. Now be warned, I have been getting blood out of my lungs the last 2-3 days. So some of this may not be pretty. I don't know, it's hard to cough. My throat's a little messed up from the live streaming. Let's see if I can get the chat on this. Because I can see it. Sorry, I do have to write everything down though too. Let me see if I can get the chat up on this. Very pretty. Oh, crap. Sorry. Didn't know this was up. Hey, Zeke. Yeah, thanks. I got the Iron Man mask stuck on my stormtrooper. Wow. I don't know if you guys even care to see that. It's not pretty. I knew that was going to happen. Well, I haven't been doing too bad lately in my exercise. I have been bleeding a little lately. About 34 years, study boy. I was about 11 when I started doing them. Yeah, that's bright. That's not good. Well, it's good, but not, I don't know. Hopefully you can hear me when I answer back. My left side is my weak side. That's why I did my right side first. My left side is normally where I cough up blood from. It's a little sore. So I do the left side if I do less than half the time and lighter. I'm already having an issue. But it happens. Like I said, I don't know if you guys really want to see that. Even the noises I'm making, that hum or whatever, is trying to get that stuff to come out of your chest. Oh, what do you guys think? My wife and I shaved my head down almost bald. We figured since it's so hot here, that I got more hair on my face than I do on top of my head. We may have set the trimmer a little too low. It's a mix. Problem is, it doesn't take a lot of blood. Sorry. It doesn't take a lot of blood to upset the cart. It makes it hard to count how much blood I'm getting out, how much other, because the blood kind of tints it all. Now, when I'm done with this side, I'll show you. The problem is the blood tints the phlegm, which is really obnoxious. Because gross as it sounds, I'm actually keep track of what color and thickness of phlegm I get out, so I can tell how bad I'm doing. But then the blood comes in and causes a problem. It's a buildup in my lungs, Isaac. My lungs have, everybody's lungs are born with what they call a chloride drainage channel. Because your lungs, when you clear your throat and cough, your lungs actually clearing stuff out of your lungs. But also you have a type of fluid going through your lungs at all time, cleaning your lungs out. Those also have drainage channels to drain that fluid out. Mine produce the fluid. It's a little too saline, too much salt in it, but also I have no the drainage channels. So it actually is the pH is off. How's that in your lungs? And causes damage. Because it kills the antibodies in my lungs, doesn't clean the crap out and lets infections happen. When the infections damage tissue, the infections and damaged tissue causes phlegm to build up, and you can't makes damaged tissue and the phlegm causes breathing issues. Does that make enough sense? I hope so. The blood isn't great, but I've been coughing up blood off and on for 10 years. No, too much of it's never good. That's a little hot, that's a decent amount, but not as much as I've coughed up in the past. I didn't cough up any all day until now. Some of the inverted therapy for my lower parts seem to do more blood. And I can even cough up more at night. I'm about done with this side. I don't know if you guys want to see what I got out or not. Some people have in the past, some don't. Right now it is pretty tinted. There's a lot of red going on there. So, all fair warning here. If you don't want to see this, definitely turn your head and close your eyes or something. That's what I got out mostly. It's a mix. Sorry. I'm going to turn my cam back on so I can see. Of course, the sound's on, unfortunately. No, that's still too far behind. I need to turn the sound down so you guys don't get doubled. There. I don't know how bright that is. Let me see here. Now that I got the sound. That's about what I got. It's, I don't know if that helps or not. All told, I got about 6 to 7 milliliters of total out, and probably 50% of it's blood. 50% of it's blood, but it probably tints the rest. I have that eye happen. It comes and goes. I'll have blood for a while, then I'll have none for a while. See, now that they don't worry, that much amount they don't worry about. They don't worry about coughing up blood unless it's a quarter cup, American quarter cup of pure blood without anything else at once. Then they worry. Now I got that set right again. Hey, I can use this to tell. Now, get it set right and do the other side. The other side would be a lot shorter because that's the side. The reason I'm coughing up blood is my left side. So I'm waiting for the cam to catch up so I can see if I'm in the right position. There. See how that looks. See how it stabilizes. Oh, man. Yeah, I don't always cough up blood, guys. That happens off and on. Right now, it just happens to be on the last day or two. Strange thing is, I seem to cough up a little more blood when I'm doing well. I've had good cardio lately and not getting as much out, but somehow I seem to cough up a little more blood when I'm like that. All right, this will be the left side. It'll be short because of the pain I got going on. Well, obviously the bleeding. If any of you guys know Lady Ryan, let her know that I did this because she wanted to see this. But I did do it, like I said tonight. And this I'm gonna do a little lighter because this is the bad side. Got a weak spot down the lower side. That popping sound is because I cup my hands. You're supposed to cup your hands. Doesn't slap, it puts the sound waves inside. I don't know if I can see the chat while I'm doing this or not. Well, I can see chat, but I can't read it because I'm upside down. I think my alarm will still go off. Hey, I wonder if I can stick it over the edge. Oh, well, nobody tells me nothing. Thanks, dude. See, I can't keep track of everybody's name on YouTube and in their life. Yeah, I got the chat hanging over my face. Yep, it worked. Okay. No, the chest therapy part is actually the short part. The breathing treatments take longer. Sorry, I usually have light the other way. I think that's right. Now I'm half blind. I'll turn this back on so I can see what's going on. Yes, it was about half the time, and I didn't do it as hard because that's where I'm bleeding from. My weak spot is actually right here, and I can feel it when it bleeds. It's sore right along this area, so I took it a little easy on it. I'm trying not to overly annoy it. If it gets really bad, they would have me stop doing the inverted therapy for a day or two and watch my workouts, which I don't. Yeah, besides the blood, the stuff I'm getting out, gross as it is, you never get used to it, isn't too bad. If it wasn't for the blood, I wouldn't be doing too bad. Anybody have any questions while I'm doing this? Questions? Ideas? Now I know the doodle will be happy with this one. Remember the movie The Abyss, where they breathed that fluid to go really deep? See, I wonder if that's possible to do that and put medication in that. And I can just breathe that fluid, that medication-filled fluid. That'd be kind of cool. I don't know if any doctors have ever seen The Abyss. Tell you what, till it's on camera, I haven't seen how short me and my wife actually cut my hair. She put it on one, as short as it'll go. It was an experiment. Wow, I was like touching deer antlers. That's all I got left. It's kind of weird. Hair on my face is double as long. Now, on a night where I'm getting a lot out, a lot of rattling going on in my chest, you can feel it, or rattling or crackling. You breathe right, you can hear it. Little crackles, click, 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 and you're breathing. I would keep going and coughing so I clear out as many of those as I could. Just trying to get stuff out. I mean, I can get anywhere from, on an average night, 5 to 15 milliliters out. And milliliters goes more with your measurements. I do try to measure stuff metric, which the hospital does. So 5 to 15 milliliters. Right now, I'm about 10 milliliters of total liquid. But look at what I got. Probably 8 to 9 consequential. And out of that, 50 to 60% is blood. A little high, but still nowhere near the quarter cup. Huge amount of blood at one time they worry about. No problem, dude. Exactly, man. I don't know if I will do the therapy, the breathing treatment too. It takes so long. I do this 2 to 3 times a day, Lady Ran. In the morning, I do it like the other one. The other one I did shows me sitting up. I do the uppers in the morning. My wife will do my back sometimes in the morning. And then I do this at night. Those are the 2 I always do. Then sometimes during the day, I'll do some laying flat on this couch and do my fronts. Or I also have this. It's a percussor. And this thing hits hard. This isn't like one of the light duty ones you've seen some places have. This ain't no massager. This thing, you gotta be careful. You can hurt yourself with this thing. It's a medical thing. Like, put it on, turn it up, and it goes. I can't even hold my arm still. So I do that. So I do my chest therapy 2 to 3 times a day. And one time I usually substitute with this because it helps. So 2 to 3 times a day, and I do breathing treatments 3 or 4 times a day. Usually I do some of the breathing treatments right after the chest therapy is the best time to do it. So when I'm done hearing a bit, coughing, I'll do a duo neb, which is albuterol, ipratropium bromide mix. I'll do that. That's in this little vial. I'll do that. Then I do a saline one. It's another vial, something like this. Then I have one called pulmozyme. You can look that up. It's pulmozyme or astrianam is the drug name. I do that one. It's another tube like this. Then I do one in a little glass bottle in a different type of nebulizer that's really fast and quiet. That's my antibiotic at the end, or my antibacterial, whatever. Does which part hurt? Doing the chest therapy or the coughing or the chest therapy does. I mean, I've built up a tolerance to it where I'm really good in a fight. If somebody hits me, it doesn't bother me as much. But yeah, it does hurt some, especially when you're sore, like coughing up blood like this. You got an itch. You can't scratch, but it's under your rib cage inside. You want to get in and rub it, and it does hurt when I'm coughing up blood. But But yeah, we do feel a lot of pain, and it affects a lot of our body. Joints hurt, muscles can hurt, your back hurts from all the coughing, it puts your back out. No problem, Zeke, man. Have a good one. Oh, this, if you hit a bone wrong, yes, it can hurt. If you're sore from doing it real hard the day before, yes, it can hurt. If you let it bounce just a little too much, you got to know how to use it right. But yeah, it can hurt on the higher levels. And I usually use it on the higher levels. But it does a good job. And it saves me having to do the work for at least one of the therapies. And it does it differently, so it helps kind of break things up in a different way. Yeah, you got to be careful. Because this is hard plastic. It's not soft. They don't want it to be soft. They don't want anything to dull. A pad would dull the percussion into your lungs. Yeah, no problem, Zeke. Thanks for checking it out, man. The chest therapy takes time, but the breathing treatments take even longer. Because out of the 4 I have to do tonight, this one will take 10 to 15 minutes. The next one takes about 15 to 20 minutes. The one after that takes about 10 to 15 minutes. And then the last one only takes like 2 to 3 minutes. So it adds up. By the time you get things switched over, blah, blah, blah. You got another hour, hour and a half in doing those. Oh, it hits hard, yeah. There's a lot of CF patients that don't like these. They won't use it because they say it hits too hard for them. They use a lot of CF patients, especially in the hospital, use a little air-powered one. Well, I find it, my cat could hit harder than that thing. So I like this one. I like to get the crap out of my chest. I actually showed it to another girl I know with CF. Now she uses one of these. Yeah, you definitely don't want to try a back massage with them. But it's got different intensities and different speeds on here. So let's see if I can show you. Like if I put it up here, you can kind of see, I don't know if you can see that. Or maybe I can hold it. But I started out, okay, great. I started out low. Now here's level 1 at low speed. Just does that. Then I change the intensity. Now it's hard. It's still slow. But I hear it slow, low speed. I change the speeds. Now you add intensity. Yeah, it's quite a little machine. And yes, it can hurt. I always have another machine down there that has a vest that vibrates your chest. I don't use it because it makes me cough up a lot more blood. It really irritates my lungs and the bad spot that I have on my left side. So the doctors have actually agreed to me, don't use that. You know, it's very expensive. Don't use it because I will cough up a lot more blood than this if I use it. Well, that right there, I'm about done doing the therapy part. All that's left is breathing treatments, is doing these. And I think nebulizer breathing treatments are pretty much the same worldwide, aren't they? You got the little electric machine down here that makes air. I got my hoses up here. Pretty much, so let me write this down real quick. Okay. Because pretty much the rest of you guys pretty much know the rest, because I think even dude said he's done a breathing treatment here or there, hasn't he? The albuterol or something. You fill the cup, garbage can. Grab the rest of my nebulizer. Put together. Hook it up. And turn it on and it hums. And that's what I do now. But I have 3 different treatments I do in the morning and at night with this unit. Then I do one with this unit that's really fast. It's the main antibiotic I do with this one. Afterwards, electric, not air. So I have 4 to do in the morning, 4 to do at night. and right now 3 in the afternoon. And I can do another 1 or 2 at another time also. So right now, regularly I'm doing 8, 9, 10. Regularly I'm doing 11 breathing treatments, but I can do up to 13 a day right now, along with my chest therapy 3 times a day. So yeah, it takes time. It takes a lot of time. That's one thing. If I do get a lung transplant after I heal, which is a long process, I wouldn't have to do all this. I'd have a lot of free time. Even if the drugs do make me diabetic or any other issues, I won't have to do hours and hours of chest therapy a day. It'd be like getting hours of my life back every day. But I'm not quite there yet. I keep holding off the transplant thing just barely. I'm doing good enough. I'm doing better at my level, and they're shocked why I'm doing so good. I'm able to keep my O2 levels up, walking, even working out. But that's my main therapy. I do at night. So if anybody has any questions, I'm not sure anybody's left besides maybe Steady Boy and Lady Ryan. But that's pretty much what it is. That's live stream of it. And you see the back of my the other side of my little sci-fi man cave, the little gray thing in the background is a very, very big, very nice air purifier that works amazingly well, but it's not super expensive. But if anybody doesn't have anything to say or any questions, I will get off here, end this stream, and get on with the breathing treatments, because the breathing treatments nobody really cares to see. Pretty much just sitting there, letting the machine feed in your breathing. There are different breathing rates for different medications that work better. The bronchodilator, I don't take deep breaths, but I take a little bit more deeper than normal breathing. The saline, I definitely try to breathe deep to irritate, to get things out. The pulmos, I usually take slow, long, deep breaths. And the Caiston, 2 schools of thought. One breathes normally, one takes slow, long, deep breaths. I found the slow, long, deep breaths work better. But I hope you guys got some info out of this. And for any CFers that see this, I hope it helps somebody out. Because not all CF people do this at home themselves. A lot of them use that vest, which I'm sorry doesn't work. A lot of them do it because it's easier. Or they have somebody do that therapy for them. Not a lot of people do the chest therapy themselves like I do. Yeah, Paul. All these here. This is ipratropium bromide and albuterol mixed in this one. And then I do this one, which is a hypertonic saline solution that helps kind of irritate and lubricate my lungs, and it gets stuff to come out even more. Then I do another one that looks a lot like this, but I don't want to get it out because it's very touchy to daylight. It doesn't like light. There's one like this. It's called Caiston Astrianam. It's a almost a DNA inhibitor. It goes through and actually kind of modifies the DNA of the critters in my lungs to try to kill them and get them out. But I don't want to get that one out because that one and the Caiston that I take are it's Pulmozyme and Caiston. Pulmozyme is the one that Astrianam. Pulmozyme and the Caiston are both extremely sensitive to light. You don't get them out of the and they're also refrigerated. You don't get them out of the refrigerator until you're about to use them. So yeah, does that answer your question, Paul? Right here I have 4 different drugs I'll be doing right here. And even this hypertonic saline is special type of saline solution that is a type of drug. So yeah, 4 different drugs right here I'll be doing right after I end the stream. Because like I said, I just sit here and I hook this up and and lose the other end of your line, and then just breathe that in. That steam coming out is the medication. And they set it up, they know how much gets lost coming up during your exhales. So I'm going to grab Junior here, set him up to head back over towards the computer. So now I got cords everywhere. Let's see. He can sit right there. Woo. Okay. Back over here. I gotta make sure I put these cords so the cat doesn't want to go get them. But yeah, that's my, what the heck did I do to my tripod? Nightly chest therapy. Sorry, I'm trying to figure out what my computer's telling me. Internet speed. Huh. No. Don't care. Well, I got that light really bright. Other than that, I'm gonna get off here and go do those breathing treatments. Like I said, I got 4 of them if you want to look them up. One is called Duoneb or ipratropium bromide mixed with albuterol. The other one is called Hypersal or Hypertonic 7% saline solution. The next one is called Pulmozyme, which is an aztreonam solution, I believe. The last one, I can't remember what the actual drug is, but look, it's Caiston is the brand name, and there's only one company that makes it. And I think Caiston actually might have came from Australia originally. So thank you, Australia, for that one. But those are the 4 if anybody wants to look them up and learn anything about the drugs. I do use 2 different nebulizer machines because I do so many breathing treatments now. If I did one, it goes over the duty cycle of the machine, can burn out my machines really quick. As it is, you're doing 11 to 13 breathing treatments a day, you do tend to burn out the machines rapidly. Even if you're using 2 different ones, so you don't have to. Now I got a backup, but maybe start getting another one as soon as one of those is starting to make some noise. It's getting very loud. Usually when your nebulizers start getting really, really loud, means you're about to give out on you. Now I've even taken apart, tried to rebuild them. It doesn't help. But for Kylie, Cystic Fibrosis Purple People Eater, thanks for checking it out. I hope I taught you something, whether you have CF or not. If you have CF, feel free to contact me with any questions. If you don't have CF, please feel free to contact me with any questions. Whether or not it's about a CF person you know, or you're just curious. But I gotta go. My voice is starting to die from all the live streaming I've done tonight and the coughing. And I will talk to you later. And thank you very much. And I gotta move this so I can even see my encoder. I'll talk to you later. And I will, any ideas for other live streams you guys want to see to do with my treatments or the disease itself, I can do talks about it. Let me know and leave it in comments below. Talk to you later.